Welcome to this explainer. Look, today we are diving straight into the messy, complicated reality of modern healthcare. We're going to explore how decentralization is quietly fixing its absolute biggest vulnerabilities. Yes, an industry that somehow still relies on paper, CDs, and fax machines is currently undergoing an invisible revolution, one that targets the very core of the entire system.
Let's kick things off with a blunt truth from our source material that just perfectly frames the issue. It says, healthcare has two databases, one for care, one for lies. Blockchain attacks the second. That hits hard, right? In healthcare, trust is basically broken. It's broken between the patient and the hospital, between pharmaceutical companies and pharmacies, and between insurers and providers. Because everyone lies, everyone audits, and as a result, everyone pays for the massive overhead of constantly having to verify the truth.
So what does that broken trust actually look like in numbers? Well, the United States alone loses a staggering $300 billion, yes, billion with a B, every single year just to administrative waste. That happens because your medical history doesn't travel with you. It's scattered across competing clinics using different software systems that absolutely refuse to talk to each other, paper folders you physically carry around, and, of course, those ancient fax machines. Nearly 30% of medical visits are missing data, which leads to billions in duplicate tests alone.
But, it's not just about wasted money. The physical stakes are so much higher. Every year, an estimated 1 million deaths are caused by a compromised global supply chain. In developing countries, up to 10% of drugs are counterfeit. Even in the massive U.S. market, fake insulin, HIV medications, and cancer treatments manage to slip right through a supply chain that bounces across 10 or more different paper-based checkpoints.
And then you add in another $100 billion a year lost in the U.S. to billing fraud, things like upcoding or phantom billing, because insurers, providers, and patients almost never share a single unified view of reality. The sheer scale of the problem is just overwhelming. The overhead of verifying what's true and what's a lie is literally suffocating the system. So how do we fix it? Well, we have to separate the decentralized hype from the reality.
Section 1. The on-chain data myth. Why crypto doesn't belong in the ER. Okay, to find the real solution here, we've got to brutally debunk the biggest myth of the decentralized health movement, the idea of putting everyone's medical records directly on the blockchain. Doing this is literally a regulatory and financial disaster. First off, blockchains are terrible at storing large files. Putting a single 200-megabyte MRI on the Ethereum network would cost you around $20,000 in fees. More importantly, it is wildly illegal. Blockchains are immutable, you can't delete things, which immediately violates GDPR's right to be forgotten and incurs a $1.5 million HIPAA fine per exposed record. It will simply get a hospital suit. So the golden rule is that you never store protected health information on-chain. Instead, successful systems keep the actual data off-chain, tucked away securely in hospital servers or even on a patient's phone. What goes on the blockchain is a cryptographic hash. Think of this as a unique digital fingerprint. It proves that a specific medical record existed at an exact time without revealing anything about the actual contents. It's a tamper-proof pointer that completely protects patient privacy. And you can see this hashing model working brilliantly in the real world right now. Take Estonia. They run their entire national health system using the KSI blockchain. They cover 99% of prescriptions and hash 95% of all health records. The medical files themselves are not on the blockchain. Instead, all providers hash their access logs to the chain. The patient holds the key and can see exactly who accessed their data and when. It operates with incredibly high trust and has had absolutely zero data breaches.
Section 2. Tracing the drug supply, the back office lifeline.
Moving away from medical records, this technology is legitimately saving lives right now in the back office logistics of the pharmaceutical supply chain. And get this, adoption wasn't driven by hype, it was literally forced by law. The Drug Supply Chain Security Act, or DSCSA, mandated that by November 2023, the industry needed electronic unit-level tracking of drugs. Suddenly, 50,000 companies needed a way to track a single bottle of pills all the way from the factory to the pharmacy. But no pharmaceutical company wanted to give a competitor, or even the FDA, monopoly control over a central database. They needed a shared ledger without a single owner.
Well, the MediLedger network solves this beautifully. It's a permission blockchain, meaning only licensed firms are allowed in, not the general public. It's like a highly exclusive club for verification. First, Pfizer makes a bottle and writes the serial number to the chain. Next, a distributor like McKesson scans it, buys it, and writes the transfer. Finally, the pharmacist at Walgreens scans the bottle, verifies its entire history on the chain, and makes sure it's 100% legitimate before selling it to a patient. If it's fake, it just gets rejected instantly.
And when you combine this shared truth with Internet of Things temperature sensors, it becomes a real game changer. Think back to the distribution of COVID-19 vaccines. The cold chain was absolutely critical. By linking a temperature sensor to the blockchain, if a shipment's temperature ever exceeded 8 degrees Celsius, a smart contract would automatically execute. It auto-rejected the spoiled shipment and triggered the insurance payout instantly, without any messy paperwork disputes. The code simply executes the truth.
Section 3. Fixing trials and billing. Plugging the million-dollar leaks.
Beyond the drug supply, there are two other massive areas where hospitals and pharmaceutical companies absolutely bleed money: clinical trials and billing. Historically, clinical trials have suffered from data integrity issues, where research sites might alter data or underreport adverse events. By stamping the raw trial data directly to the ledger as a hash, it creates an immutable timestamp. Research sites physically cannot alter or backdate adverse events. Pfizer actually used this for their COVID-19 trials. And because regulators like the FDA can mathematically trust the audit trail, they can approve life-saving drugs faster.
And then there is the absolute nightmare of medical billing. Currently, a hospital sends a claim, the insurer checks it, and you're stuck waiting 30 to 90 days with a 20% denial rate. It's a system that costs $500 billion in administration. But in pilot programs using smart contracts, like the ones run by Change Healthcare, the rules are coded publicly. If the diagnosis and procedure match the policy, the smart contract settles the payment in just 5 seconds. 5 seconds! It completely cuts out the 90-day back and forth and reduces fraud, like upcoding, by 30%.
Section 4. The invisible blockchain future. What ships by 2030.
Now, for these incredible pilot programs to become the global standard by 2030, the technology must overcome the ultimate legal hurdle: ironclad patient privacy. To comply with super strict laws like HIPAA and GDPR, all future health networks are going to have to rely on a cryptographic method called zero-knowledge proofs. This is so cool. It allows you to mathematically prove a statement is true without revealing the underlying data. So you could prove a patient is eligible for an insurance claim or prove they're over 18 without ever transmitting their actual birth date, A1C levels, or medical records. The chain handles the proofs, the data stays hidden.
Ultimately, what actually survives the hype by 2030 is deeply pragmatic. We're going to see drug supply tracing, patient consent managed by smart contracts, trial data timestamping, and automated simple claims becoming the norm. On the flip side, what definitely won't ship are the wild fantasies: putting electronic health records on chain, DAOs trying to run hospitals, paying in Bitcoin for copays, or paying patients for their data. The real winners here are all in the boring, essential back office. So, the ultimate thesis from our source material is that the winning decentralized applications in healthcare will function exactly like TCP/IP, the underlying protocol of the internet. They're going to be essential, they'll be everywhere, but they will be completely unseen by the end user. If a patient ever has to click a button that says "Scan QR to connect wallet," the system has failed.
To wrap up this explainer, the big takeaway is super clear. Blockchain isn't some magic wand. It's not going to fix every single ill in the healthcare system, but it perfectly attacks the massive, incredibly expensive crises of trust, provenance, and auditing. The applications that truly transform the system will be entirely boring, totally legally compliant, and completely invisible to you and me. So the next time you pick up a prescription or check out at the doctor's office, take a second to consider the invisible digital supply chain working quietly in the background to ensure your safety and protect your data. And ask yourself, are you ready to trust the unseen pipes of tomorrow's healthcare? Thanks for joining me for this explainer, and keep learning.